Good afternoon, everyone. I'd like to welcome you to this webinar, which outlines how you can demonstrate your excellence in IBD care and also earn some rewards using the AGA's new Bridges to Excellence IBD Care Recognition Program. So this is our agenda for today. We're going to discuss what the Bridges to Excellence program is and why it matters, what the Physician Quality Reporting System, or PQRS, is and why it should be important to you, how to participate in the program, and then we'll have an open question and answer session at the conclusion of the presentation. So let's talk a little bit about Bridges to Excellence, which many of you may not be familiar with. Bridges to Excellence, now a part of the Healthcare Incentives Improvement Institute, is a program that was founded in 2002. The program was founded based on requests from purchasers and payers to find a way to objectively measure quality from the clinical providers that they have in their networks. The goal is that you demonstrate this quality to the 3 Ps: purchasers, payers, and patients. BTE programs have received recognition from payers across the country, many of which offer monetary incentives, inclusion in premium directories, and in the future, things like inclusion in narrowed or tiered networks based on whether or not you're recognized. They also provide other rewards for demonstrating quality. So Bridges to Excellence has some established programs that have been around for quite a bit. You can see the laundry list here, things like asthma, diabetes, also getting into physician office systems and how they interact with other offices, patient-centered medical homes. But when we looked at the Bridges programs, we had one big question on our mind: where's GI? There really hasn't been a Bridges to Excellence program that directly addresses the needs of gastroenterologists. So that's when we began working with Bridges to develop the IBD Care Recognition Program. So this is the first and the only Bridges to Excellence program that is designed by and for gastroenterologists. It uses nationally endorsed measures that have been endorsed by the AMA's Physician Consortium for Performance Improvement, are included in the CMS's Physician Quality Reporting System, and several of which have been submitted to the National Quality Forum for evaluation and inclusion in their measure sets. So why would you want to participate in this? Well, it's a great way to demonstrate your quality of care to your patients and distinguish yourself. You receive public recognition for this achievement, both through being able to use your BTE recognition in any public materials, as well as listing on vitals.com, which shows whether or not you're BTE recognized. Additionally, some of the payers have a quality star or another designation that shows up in their directories if you've achieved this mark. It provides proof that you are performing quality care, and it provides it to the payers. This is very important because Bridges to Excellence's model has been established over such a long period of time, and it's so trusted by the payers. This provides instant credit in their eyes that is unquestionable. Bridges has very rigorous standards for developing these programs, and because of all of the work that's been done in other specialties before us, by following that model, we don't have to prove ourselves with this new program. It uses nationally endorsed measures and it follows the model, so the program has instant credibility. This program also allows you to meet your PQRS reporting requirements, and I'm going to get into some details about how that works exactly, but the shorthand of it is you report the same measures for evaluation for Bridges to Excellence as you do for PQRS. You report the same data, and you do it all through a single process. And coming in 2013, we're currently working to develop an American Board of Internal Medicine practice improvement module for IBD that would use the same data and the same measures. And once that has been developed, sometime in mid to late 2013, we're hoping it'll have been approved, and we'll incorporate it into this program as well, so you can do your PQRS Bridges to Excellence and completes your practice improvement module to maintain your maintenance and certification all in one place, all through the same process, all with the same data. So let's talk a little bit about PQRS. Although PQRS was started in 2007, I personally speak to a lot of clinicians that remain unfamiliar with it. It's a program that was created by CMS by which eligible providers report their quality or their quality measure results to CMS. Previously, bonuses have been awarded on all Medicare Part B charges for the year if you successfully report your results to CMS. Very important thing here is that that bonus is not awarded based on performance on the measures. It's based on whether or not you chose to report and you followed the rules for doing so. So since 2007, there have been options out there to achieve a bonus from CMS by participating in this program. But the landscape is changing a bit. So why should you really care? Well, this year and in 2013, you can get a 0.5% bonus on all Medicare Part B charges if you successfully report. But things are changing very quickly. Starting in 2013, if you do not report your 2013 PQRS, you will be penalized on all Medicare Part B charges in 2015. And that trips folks up sometimes. There's a 2-year lag. But that 2-year lag is going to continue on a rolling basis. So you can see on the right-hand side, in 2012, you don't get penalized for not reporting. And by reporting, you can get this 0.5% bonus. The same thing in 2013 and the same thing in 2014. But if you haven't reported in 2013, you're going to lose 1.5% across the board on all Part B charges for 2015. If you don't report in 2014, you're going to lose 2% across the board in 2016. And if you don't report in 2015, you lose another 2% across the board in 2017. Now, I think some folks look at this and sometimes think, well, I can absorb 1% across Part B. I can, potentially absorb 2% of a loss across Part B. But let's look at the broader perspective around CMS's quality programs and really see what I like to call the CMS penalty box that's currently happening and is evolving. So in 2012, you have 3 different quality incentive programs that you can potentially earn credit for, and only one of which right now results in a penalty, the e-prescribing program. So if you didn't report through CMS's e-prescribing program for 2012, or you don't report, you're going to lose 1% across all your Part B charges. If you didn't participate in the EMR, the meaningful use side of things, or PQRS, then it's neutral. You don't lose anything on those this year. In 2013, if you don't e-prescribe, you're going to lose 1.5% on your charges. And once again, your EMR and PQRS, there's an option there to get a bonus, but not participating in those doesn't result in a penalty yet. Starting in 2014, no e-prescription, you lose 2%. Once again, EMR and PQRS unchanged for that year, but in 2015, the e-prescribing penalty goes away. But by not using a meaningful use certified EMR and reporting that to CMS, you will lose 1% across all Part B charges, and you will lose 1.5% across all charges for not doing PQRS. So you can see that they're stepping it up gradually. We've gone from a 1% to a 1.5% to 2% to 2.5%. I think you can see where this is going. In 2016, both of the penalties for EMR and PQRS noncompliance jump. You're now up to 4% of all your Part B charges will be cut out. And then in 2017, that's going to climb to 5%. So it's crucial that you understand what's coming down the pike. It's crucial to understand that participation in these programs has to happen sooner rather than later, because there's a rolling lag on the penalties for many of them. So, for example, the not reporting PQRS in 2013 results in that penalty of 1.5% in 2015. So, plain and simple, if you don't report PQRS starting in 2013, you're going to be penalized in 2015, and you're going to be penalized moving forward until you start reporting. 2012, which is what we're talking about right now today, is the last year to participate in PQRS with only potential upside. So you'll never, in 2012, be penalized in any way for submitting to PQRS. You only have the option to get a 0.5% bonus for all your Part B charges. But this is the last year that happens. Next year, you can still potentially get a 0.5% bonus, but if you don't submit, that's when the penalty kicks in. All that aside, not to sound like a lot of doom and gloom, the AGA is here to help. So what we're offering is through our new Bridges to Excellence program. It's fully integrated with PQRS for reporting the inflammatory bowel disease measures group. And the AGA has worked with CMS to develop that measures group up until the last year or so. There really hasn't been a measure group with CMS that directly addresses the needs of gastroenterologists. There's been a hepatitis C measures group in the program for quite some time. Most people, though, we found aren't treating enough hepatitis C patients, or at least most GIs, that are Medicare Part B to meet the requirements. So the hope is that now that we have a new IBD measures group, that'll apply to more gastroenterologists, and the AGA is continuing to work on national measure set with the hope of giving gastroenterologists more opportunity to report measures that matter to them so they can qualify for these programs. So the PQRS submission and Bridges to Excellence use the exact same measures and the exact same data. So you don't have to worry about two different sets of reporting requirements other than a small difference in the patient samples that I'll go over in a moment. But at the end of your submission, you'll be sending the same measure results, and all the data you collect will be the same for every patient. We do have sample sharing to reduce data collection. That means that if you're submitting both for CMS PQRS and submitting to be evaluated for Bridges to Excellence, what you would do is complete your Bridges to Excellence sample first, and then count up the number of patients in that sample that also qualify for PQRS. And we'll submit those on your behalf for PQRS, and then you just need to collect however many additional PQRS patients you need to meet the minimum sample for CMS. And then, as mentioned, starting in 2013, we're looking to integrate a full ABIM practice improvement module. Same process, same data, same measures. So, to get started, first and foremost, you'll visit agarecognition.org and review the policies and procedures guide that's there, and I can't stress that enough. It'll answer a lot of the questions that you have. The second step will be based on what you learned today, and in the policies and procedures guide, you'll identify the patients that you'll need to submit to one or both programs. You'll then abstract data from the charts, enter that data using the web-based tool that we provide, and then submit the data to the AGA. And we take care of the rest from there. Bridges to Excellence performs their own assessment to determine whether or not you meet the minimum standard for recognition, and the data are submitted to CMS for their processing, and CMS contacts you to let you know when you've got your bonus. So I won't strain your eyes too much with this slide, but this is a list of the measures that are included in the program. And as mentioned, these all correspond to PQRS measures. Now, on the right-hand side, you'll see a points column. And the way this works is that every measure is worth a certain number of points, and based on how many patients meet the measure, you get that share of points. At the end, all those are summed, and if you get at least 60 points, that's the threshold for Bridges to Excellence recognition. Your performance on these measures does not impact your PQRS submission, because you get credit for PQRS just by submitting data, not based on your results. So I think we've gone over this. What you need to do to get started, visit the website, review the guide, have a look at the data collection form so you understand what you'll need to do for the program, and then you can register and pay your fees all online. We have technical support available on the website through a quick link. Someone will contact you very shortly after you put in a request, and this technical support is for things like if you've forgotten your password, you need some help getting through the registration process or have a question about how to use the web-based tool. If you want one-on-one training, or if you have any clinical content questions or just would prefer to talk to us, you can contact us at recognition@gastro.org. Here are the upcoming deadlines you need to know about. To submit for PQRS 2012 through this program, you must have your submission made by March 14th, 2013. And that's a hard deadline. We don't have any flexibility to extend that. So the data that do not come in by midnight on the 14th, unfortunately, cannot be included for 2012 PQRS. If you're looking to submit Bridges to Excellence and you want to be assessed in Q1 2013, then your deadline is December 31st of this year. Now, I should note that you can submit your data for either of these programs or one of these or both these programs at any time between now and March 14th if you're doing PQRS. The way that the BTE assessment works is that when we receive data in a particular quarter, like Q4 right now, we have a deadline at the end of the quarter and we perform the assessment in the next quarter. So you can still submit your PQRS data before the 31st if you'd like, and it'll still be submitted for you in March. That doesn't change. If you want to do both BTE and PQRS, or you want to do BTE for assessment in Q2, meaning you submit it in Q1 2013, the date is the same for the Q1 assessment for BTE. It's March 14th because we want to keep those the same. You have to excuse me, that says 2012. It should say 2013. These are the fees. You can see there's an AGA member rate for each and a non-member rate for each. And there's significant savings if you submit for both programs at the same time. Now, if you're recognized by Bridges to Excellence, that recognition lasts for 2 years. So that's only a process you would have to do once every 2 years, assuming you're recognized. PQRS, however, must be submitted annually. What you would do if you would like to get recognized by Bridges to Excellence and take care of PQRS this year is you would submit under the combined package on the bottom. And then if you're recognized by BTE, when you report PQRS for 2013, you'll only come back and do PQRS only. And your Bridges to Excellence recognition will continue, and we'll let you know when that's about to expire. So these are the requirements to participate in the Bridges to Excellence program. You need to treat at least 25 adult patients with IBD within the past year. We also need you to be either a physician, a DO, an NP, or a PA. All those are eligible for this program as long as the patients you're reporting you have responsibility for care over. You'll need to complete data collection for 25 consecutive unique patients. Consecutive, of course, means consecutive visits, and unique means unique. Based on your performance on the quality measures and the weights of those measures, you'll need to score at least 60 out of 100 points to be recognized. For PQRS submission through this program, you'll need to have billed at least 30 Medicare Part B patients with Medicare Part B as the primary payer who had IBD in 2012 using the ICD-9 and E&M codes provided by CMS. And we include those in the Policies and Procedures Guide for the program. It's very important that you make sure that you build at least 30 Part B patients using those codes within 2012 because CMS does a cross-check to make sure you had enough patients billed under those codes to determine whether or not you're allowed to submit for the IBD measures group. You'll need to report data on all 30 patients, and as mentioned, these are the same data that you would report for the Bridges to Excellence program. We'll submit your results to CMS by the end of March of 2013, which is the final deadline. And I should note your bonus is based on participation, not performance. So your submission for PQRS this year only has upside potential. There's no such thing as failing performance for PQRS. Now, If you decide that you're going to report to both, you're going to apply for Bridges to Excellence as well as report your PQRS. You can count patients from your Bridges to Excellence sample towards your PQRS sample as long as they meet the PQRS criteria. This should save you a little bit of time and effort. It reduces the number of patients that you'll need to submit. So here's an example of how that sampling would work. So let's say this is our BTE sample. It's 25 consecutive unique adult patients with IBD. You would find those patients first when you do the identification process in the beginning, and then determine which of those also qualify for PQRS. So next example, out of the 25 BTE patients, 8 of them would be eligible for PQRS. So that means that to meet the total patient requirement for PQRS, which is 30, you'd need to find 17 more patients that met the PQRS criteria. And then that would mean that you're reporting a total of 42 patients instead of having to report 25 for BTE and then another 30 for PQRS, making that 55 patients. Once you've identified your patients, you can collect data using the paper form that we provide and the data definitions, and then enter it into the web-based tool, or you can sit there with your chart and enter data directly into the web-based tool that way, whichever process works best for you. This is a snapshot of the data collection form. I want to point out a few key things here. Number one, at the top, you'll see this PQRS only box. This is very important because if you're submitting for both Bridges to Excellence and PQRS, you'll need to identify your Bridges to Excellence sample first, and then ideally, to make things easy for you, go ahead and collect data for those Bridges to Excellence patients first. Once you've identified how many of those Bridges to Excellence patients also qualify for PQRS, you then need to go and find the remaining PQRS patients among your patients. Now, those PQRS patients do not have to be consecutive like Bridges to Excellence. But when you go and find those other PQRS patients that you're not submitting for your Bridges sample, you have to mark them as PQRS only. That tells the assessors to ignore those extra patients that you added to meet PQRS and not factor them into your calculation for your Bridges assessment. I also want to say that you put a data collection form in front of folks, and sometimes you get a little jumpy. It looks like a tremendous amount to have to complete. But you'll see that we have a lot of questions in here about if this was yes, then answer this, or if this was no, skip this section. So it's actually impossible clinically to have to answer every question on this form based on the way it's structured. And you'll see for some of these, you might just say it wasn't assessed in the past year, and you just move on to the next section. Or for some of them, if you meet the quality action, then you just move on to the next section, and you don't have to worry about documenting anything else. In this larger top section, another example for the disease assessment, there's a lot of questions there, but some of them only apply to Crohn's disease, and some of them only apply to ulcerative colitis. So you won't be completing every single piece of information on this form for every patient. As far as documentation goes, this is very important. Everything that you report must be clearly documented in the medical record. For most items, when you look at the definitions of the measures, you'll be able to see this in the program materials, you're going to have to provide a date assessed or a date documented for these. And this is for the purposes of cross-referencing and performing audits. However, there's often some confusion around these measures. So just because you provide a date assessed or a date documented, it doesn't always mean that the clinician was the one that performed the action. Oftentimes, and I'll give you an example in a moment, you're only looking for documentation in the medical record that the patient was assessed and a proper action was taken if it was warranted. So for example, I hear a lot of questions about this one, the flu immunization measure. A lot of GIs tell me, I don't administer Fluvax. Well, that's actually fine. You don't have to meet the measure. To meet the measure, the clinician has to make sure that a flu vax was administered, recommended, or prescribed within the past year unless there was a patient, medical, or system reason for not doing so. The clinician doesn't need to actually administer the immunization. You have to make sure at a minimum that if that one was administered by another clinician perhaps in another office, and if not, either administer, prescribe, or recommend one. So if you verify with the patient that they haven't had a flu vax in the last year, it's enough to actually recommend that they have one. As long as that's documented clearly in the medical record, that meets the measure. So once you've completed all of your data entry, you'll be given the option to submit your results. And this is very important. If you're submitting for both the PQRS and Bridges to Excellence program, do not hit the submit button until you've entered all patients for both programs. There's been a little confusion sometimes where people think they finish their Bridges sample and hit submit and then come back and do their PQRS and hit submit. It's an all-in-one process. So you have to make sure, if you're doing both, record your 25 consecutive patients for Bridges, record the remaining patients you need to fill out your PQRS sample, and mark them as PQRS only. And once you have all of those patients, that's when you hit submit. After you submit, it'll give you a display of your measure results so you can see how you did. But those measure results for Bridges to Excellence are only preliminary because Bridges to Excellence ultimately makes the decision as to whether or not you're recognized under the program. The AGA does not make that decision to eliminate any conflict of interest that we might have by assessing our own members. If you're submitting for BTE, your submission gets evaluated during the next quarter, and your results will be sent back to you by Bridges to Excellence. If you're recognized, they'll let you know. They'll put your listing on vitals.com, send you a frameable certificate, and they'll also begin reporting the fact that you're recognized to the payers that they're partnered with. If you're not recognized, BTE will let you know and for what reason. And the payers, no one else actually, gets told that you submitted but didn't meet the criteria. So there's only upside on BTE as well. It will never be reported that you submitted to the program but did not meet the criteria. And if you don't meet the criteria, we here at AGA can work with you to develop a quality improvement plan, and then you're able to submit again after 6 months have passed. And we do ideally want everyone to be able to achieve the Bridges standard. So we're here to help if you happen to not meet the mark on your first try. Don't lose heart. We can get you there. If you're submitting for PQRS, you'll be notified when your submission has been sent to CMS. And please remember, your measure results do not have an impact on your PQRS qualification. You qualify for that bonus by reporting, not based on how well you did. And very important, CMS solely determines if you qualify for a bonus. The AGA has absolutely no ability to influence this decision. And if you successfully qualify, CMS will send you your bonus check, not the AGA. We're unable to provide you any information about where that process lies. You have to contact CMS after your data are submitted if you have any questions. What if you get audited? Well, don't panic. An audit does not mean that you've done anything wrong. And I'll note here, audit means Bridges to Excellence audit, not PQRS. So we have to do regular audits of a random number of applicants. It's a Bridges to Excellence requirement to make sure that the program retains its integrity. And keep in mind that an audit can sometimes give you a better score than originally, because sometimes there's a misunderstanding of the program requirements, and what you report actually makes you look like you didn't do as well as you actually did. So if you are selected for an audit, we'll contact you and we'll arrange a review of a select number of charts to verify accuracy. And we'll do that in whichever way works best for you. It could be done over a webinar. It could be done by sending de-identified charts in for review side by side with your data. We figure that out with you to make sure that we do whatever works best for you. And audit results have absolutely no effect on your PQRS submission. The BTE and PQRS data go to two separate sources, and no matter what, your PQRS data, as long as you submitted the right number of patients with the correct diagnosis codes, those will be submitted to CMS, and those processes at that point are distinct. So, in summary, the BTE IBD Care Recognition Program can help you earn rewards and recognition that you can demonstrate to payers, purchasers, and patients. You can meet your CMS PQRS requirements through this program, and you can protect your bottom line from upcoming penalties. And in the future, not participating in some of the private payer programs is going to result in the same sorts of negatives that you're seeing at the governmental level, because the for-profit payers tend to follow what the CMS does. So this is the sort of program that by getting involved now, participating, understanding what's required, and improving your clinical processes, you can make sure that you're demonstrating high quality, and you can make sure that you're protecting yourselves from penalty. And once again, this is an all-in-one way to do things. So you don't have to worry about going to multiple websites or registering for multiple programs to submit for both of these programs. You can do it all in one place, and you can do it all with the same data. And if you're submitting for PQRS 2012, I have to reiterate one more time, the deadline is March 14th, 2013 for this program. So if this is something you're interested in, I strongly suggest that you go ahead and review the program materials, contact us with any questions you might have, and we will be more than happy to walk you through everything you need to successfully submit, because we want to see as many GIs as possible be able to take advantage of the first GI-specific measures group for PQRS. As mentioned, all of the guidelines, online registration, and technical support is at agarecognition.org. And if you have any questions about the clinical content of the program, or would just like to talk to us at AGA, or if you want to schedule a little one-on-one training, just email us at recognition@gastro.org, and we'll be more than happy to set something up with you. So with that said, I'd like to open the floor to questions, and I'll do my best to answer them. If you look at the GoToMeeting webinar panel, you'll see a section for questions, and I see I've already got a few coming in. So if you have a question, go ahead and type it into the panel, and I'll answer them in order. So the first question we have is, does CMS have an IBD measures group without going through AGA? Well, CMS offers multiple ways to report PQRS measures. The way that the AGA is offering is through what's called measures group reporting through the registry option. By doing measures group reporting through the registry option, it means that you only need to submit 30 Part B patients, and you have to submit data for that measures group on all those patients. Some of the other options are things like claims-based reporting, which a lot of folks are familiar with because it was the first option for PQRS. And what that means is with every claim that you submit to Medicare, you have to include specialized quality codes, G codes, if you've heard of those, to qualify for the program. One of the difficulties with that is, number one, it's a lot of work if you're having to submit that information for all of your Part B patients. And number two, there's no feedback loop throughout the year from CMS to determine how many of the patients you remembered to submit those codes for. So we heard some horror stories over the years where people invest a lot of money either within their office or paying a coding and billing company to submit PQRS, but they missed the minimum number of patients by maybe 1 or 2%. And at the end of the day, CMS doesn't care if it's a small percentage or a large percentage. If you don't report the minimum number of patients, you simply don't get the bonus. So the AGA has gone with this registry sample option because it's really the easiest way to meet those requirements. And you can do it any time of the year that you need to. Like right now, you can submit for this all the way up until March of next year. If you were doing something like the claims option, then you'd have a lot of catch-up to do to go through all of your 2012 claims and submit those codes. So The next question is PQRS different than meaningful use, the EMR that includes some PQRS? I'm going to answer this to the best of my ability because I'll be honest with you, I'm not a meaningful use expert. But PQRS is distinct from meaningful use. Now, there are requirements within meaningful use that your EHR needs to be able to calculate certain quality measures. But as it stands right now, the quality measures required in EHRs for meaningful use do not match up 100% with PQRS. And PQRS submission is something that's distinct from meaningful use as well. So if you have an EHR that reports PQRS measures, then you can go through what's called the EHR option to report that information. And you can talk to your EHR vendor to find out if your EHR qualifies for that. But there's no requirement that I'm aware of in meaningful use yet that those PQRS measures have to be replicated in every EHR. And you have to be careful when you're doing the EHR reporting method for PQRS because not all EHRs qualify for it. That'd be a question for your vendor. Next question is, what if most of my IBD patients are non-Medicare? Well, if most of them are non-Medicare, as long as you have at least 25, you can still apply for Bridges to Excellence recognition. So that's one piece of good news. The piece of not so good news is that CMS is requiring a minimum of 30 patients throughout the year with IBD if you want to report with this measures group. But there are other measures groups within PQRS, and there is an option to select 3 measures at a minimum and report those on at least half of your Part B patients. If you have any questions about other options for PQRS reporting, you can contact us at that recognition@gastro.org. And the AGA has a lot of resources around PQRS because the program is much larger than what's been presented today. We're really presenting this GI-focused version based on the IBD measures group. But there are other options for reporting, so if you contact us, we can probably work with you to find out which one is going to work best for you. Okay, next question is, we did claims-based reporting for PQRS measures for the first half of 2012. Can we participate in Bridges to Excellence and PQRS through the AGA, even though we've already submitted January through May directly to CMS? The answer to that is yes, with a caveat. You don't get any additional credit from CMS by submitting both claims and registry. What they're looking for is successful submission among whichever method you choose. So if you submit more than one, you don't get to double your bonus, unfortunately. If you'd like to go ahead and submit your PQRS measures to this program, you can certainly do it. That's happened in the past with other PQRS programs I've worked on. Sometimes folks get halfway through the year and get frustrated and decide they don't want to do the claims reporting anymore. Sometimes folks do claims reporting and they submit the registry option with a patient sample as a backup plan, just in case they don't meet the minimum threshold for claims reporting, because as I mentioned, sometimes it's hard to tell if you've submitted enough patients through that model. So you can certainly do both. And as long as you make it at the March 14th deadline for PQRS, you'll be absolutely fine with that. Next question is, will the number of patients needed for reporting change? And I assume that this question is about PQRS because it has been announced that there will be a change in the rules next year for 2013 reporting for the measures groups in PQRS. And it's a good announcement. Thankfully, CMS doesn't always make great announcements. I'm sure you're all familiar. This one we're happy with. And it's that the number of patients you need to report in 2013 through this measures group option is actually only going to be 20 patients. And only half of those patients have to be Medicare Part B.